white paper. I know that you all have that as part of the process of looking at the brand. So we're going to dig deeper into that. And today I'm really excited to have Dean Ulizio with us. Dean is our Chief Strategy Officer at BrightStar Care. He's going on, I just found out, going on 20 years with BrightStar. So started off as a franchisee in the Denver, Colorado area, and has been with the corporate office now for a number of years, but has obviously seen the brand evolve over time and is heading up the strategy on where we are today, but also where we're going tomorrow. So he and I are going to kind of walk through some of the things that are in this year's white paper, talk through some of the strategies that have powered our brand's consistent growth and really sets us apart in an industry that, as you know, if you're looking at this, there's a lot of different brands out there and it's a very competitive space. But we've been able to continue our rapid growth and our franchisee growth across the country. So you'll hear some real insights on the business model, what our approach is to building high performing teams, and the breadth of services that we provide with the multiple revenue streams, and some of those competitive advantages that really make BrightStar Care the leader in the home healthcare space. So Claire's going to kick it off with our first question, and we'll get things underway.
Awesome. Thanks, Pete. So the first question I have is for you, Pete, and it is for someone exploring BrightStar Care as a franchise opportunity. Can you walk us through the investment, the franchise fee, and what's included overall in that package?
Yeah, I think the franchise, financing is really important for any business that anyone's considering out there. You've got to be properly capitalized to really be able to hit the ground running. So with BrightStar Care, the initial investment ranges anywhere from 130 to 230,000. That's really for your first few months of operations, getting things set up, getting going, and then with working capital, all in, you can plan on an investment of probably around 300. So that's a kind of our rule of thumb with working capital to get you on board. The way that fee is broken down, 50,000 of that is the initial franchise fee. And that is for a territory size of about 200 to 300,000 people. And those are protected territories and areas, that you'll be assigned by zip code for your area for growth. What we've found, and we do a lot of statistics and run a lot of data. What we found is that the larger the territory does not necessarily translate into a larger opportunity for revenue. It's really about focusing not only on the overall population base, but the population base over 65. So part of your due diligence, you're going to get a lot of information on demographics by zip code in your particular territory that you're looking at. So we take a look at the senior count to make sure that there's a healthy number of seniors in your area. And then we also look at household income as well, because a lot of our business is private pay. So it's important to have the income levels where our typical clients will be and our typical patients will be at. So other things as part of that investment, the training is key. And we're going to talk a lot about training as we go throughout the day, but we've modified our training program to really break it down into a 27-month period. So you've got the 3-month time period before you open, and then you'll have the traditional classroom style settings where you'll do your new owner training, and there's 2 weeks of that done at 2 different times. And then you'll have a coach that's with you all the way through the first couple of years that you're open and operating. And we're doing that because we really want you to have and get the information that you need at the time that you need it. And we found early on we were providing just a ton of information and training, but by the time that was all done, and when you needed to access that information, retaining that was a little bit of a challenge. So now the new training program that we've rolled out over the last couple of years has really been successful and well received by franchisees because they're getting that information that they need at the right time. So that's the traditional training. We have a proprietary software system. So that's software you may have heard about it as you've been going through your due diligence, but that streamlines scheduling, billing, manages your clients. And then we also have large national marketing programs, whether it's a national TV campaign or your local marketing that really is where we're focused in your markets. Because we're a national brand, but ultimately the business really is driven by the local franchisee in that market. So becoming the household name in your particular area. We have a lot of tools available for you to do that. So, in a nutshell, this definitely isn't something that you're starting from scratch. And I think that's why most people look at a franchise model. They know that they've got a proven model that's in place, and they need to be able to implement that in their particular territory. So over the last 20 plus years that we've been franchising, that model's been refined, and it's really built to deliver results to you as an owner. So you're stepping in, into a business that has proven systems in place, branding that is, well aware out in the community, and then an infrastructure that's designed really to help you succeed and hit the ground running from day one.
Awesome. Thank you, Pete. The next question I have is around a common question that you receive, and this is, do franchisees need healthcare experience to succeed in this business?
That is a very common question, and the answer is no. So, we're a healthcare brand, healthcare business, and we provide amazing care across the country, but you don't need to have that background in healthcare. What we really find with our successful owners is someone that perhaps came from a corporate leadership position. They're used to managing teams, may have a background in sales. We've got amazing franchisees that came from an education space. They were teachers. Hospitality is another area where we tend to attract a lot of a lot of potential franchisees. And really, what it boils down to is you need to be able to lead your team. You're going to have an office staff that needs your guidance, and then you're going to have a large group of caregivers out in the field that also need to be guided and directed. And so those that can manage and operate and really lead the teams tend to have a lot of success. So it's, having that growth minded area mindset is really important too. So if you think about it, you're coming into a business, and our goal is to have you come into your initial territory and really build a business and something that you can scale. And you can do that with BrightStar. So over half of our owners have more than one location. We have several franchisees that have multiple locations across various regions. But it's having that desire to come in, really focus on the first territory that you have, but just know that you've got the ability to scale and the desire to scale after that. Leadership is key. So we'll talk a little bit about that today too. And we really are a mission driven business. I would say 85 to 90% of the new owners that come into our system have had some experience with home health care before, whether it was with their mom or dad or their grandparent or another loved one. They have some past experience that drove them to this and to have the desire to get into senior care and into home care. We all know the demographics. We can all see where this is going. The wind is at our back for quite some time as far as the demographics go with seniors aging, and our typical client now is getting older too. So we have that ability to go in and focus on the demographics, but we also have to look for franchisees, and we want to look for franchisees that really have the heart and the desire to serve in their community, because we really do become a part of that community. And if you think about what we do, we're changing the lives of our clients, but also their families, and providing them with that peace of mind. So if you come in with that sort of mentality and a desire to do well in your community and provide that type of service, that is a home run. We are a franchise brand, so we have lots of processes in place, and we're really focused on that. Operationally, we have all of the toolkits available for you. And so being able to be coachable, follow those processes, and find ways, obviously, to enhance them, which is what we do all the time. We're continuously learning on that. So that's kind of the background of the type of person that we look for and the type of people that have real success here. So, we can provide you with the training, the business model, the tools, and then it's up to you as an owner to really take the reins, lead your team with purpose, and build that relationship in the community. And that's really where the magic happens.
Wonderful. Dean, the next question is for you. One of the most exciting differentiators for BrightStar Care is the breadth of services you offer. Can you walk us through the full continuum of care and the revenue streams available to franchisees?
Sure. Thanks, Claire. And good afternoon, everyone. It's always a pleasure to be able to speak to people who are considered joining the BrightStar team. So, from its very beginning, BrightStar is really focused on providing a higher standard of care and delivering peace of mind to families trying to care for their loved ones. A lot of that is about keeping our clients home safely. Overwhelmingly, people want to age in place and stay home. Like every research report that I see shows that number 70, 80% and greater. So our vision as a brand is really to provide a full continuum of care. So to be able to be on the journey with our clients as their needs progress, and being able to adapt to those changes. So we offer the full continuum of care. That would start with the most basic levels of companion care, so socialization and being there for people with them. And it progresses to what we call personal care, which is more hands-on care where we're assisting our clients with the activities of daily living that they need to be independent and stay at home. And then it can progress even beyond that to skilled care, where you now have a licensed nurse or a licensed therapist providing care that's maybe been ordered by a doctor or other prescriber. So that allows our client care plans to adapt and grow as the client needs change. We also have some interesting parts of our business. One is what we do around medical staffing, which is basically creating an opportunity for you to deploy your team as a workforce solution to partners, both local partners as well as national partners, to provide care in facilities such as assisted livings or hospitals or events or clinics. And our national account program, which is a big part driving our staffing business, that allows BrightStar agencies to provide care on behalf of other healthcare organizations, such as the VA, insurance companies, specialty pharmacies. So that gets you into even more homes. So we really do have a very broad model with multiple revenue streams that can support a full continuum of care for the clients we seek. And what this means is locally, as an owner, you're really allowed to take advantage of these opportunities and see which ones are the best fit for your market and pursue kind of maximum revenue growth by going to where the opportunity is.
Awesome. Thanks, Dean. My next question for you is staffing is always top of mind in healthcare. What systems and tools do you provide to franchisees to build strong care teams and recruit nurses?
Great question. So our business is really all about the people delivering the care and the clients receiving it. So it starts with kind of a culture we create. And as Pete mentioned, that's part of the owner's role, is to really build that right team and set that right culture. Part of our model is that every BrightStar Care location has a director of nursing. So this is a registered nurse who oversees all the client care and supports the caregivers in the field and models. So that not only brings like a additional level of medical expertise to what we're doing, but it also provides an opportunity for caregivers to grow and be mentored by someone who's a little bit more advanced in the field than they are. So in addition to that model that's focused on quality and clinical expertise, we're also providing our owners with tools, education, and marketing support, which focuses on the core activities of recruiting and retaining a bench of top talent. So this includes a lot of different things. We have pre-built hiring templates, interview guides, sample onboarding materials. We have ongoing leadership training for the key roles in the office and the directors of nursing as part of that. We have a great track record of being accredited across our network with the Joint Commission, which is a leading accredited organization, and that attracts clinical professionals who are looking for some validation of the quality of the providers they're going to work with. And then we have partnerships with various suppliers that give you effective tools for things like job posting, recruiting, and onboarding support. So there's lots of tools, lots of assets. But what's really important is that, as Pete mentioned, a lot of people are called to healthcare because of the mission. And nurses generally are looking for more than a paycheck. They want autonomy. They want respect for their expertise. They want flexibility, all of which we can offer. But a lot of them really are looking at, where is there a culture of an organization that fits my values and I can achieve my mission. And so we built this system that gives them that, which means, you're not just hiring nurses, but you're really hiring nurses and then empowering them to do their best work.
Great. Pete, my next question is for you to talk a little bit about competitive advantages. So the question is, what truly sets BrightStar Care apart in the home healthcare industry?
I think that there's a few different things, and it really comes down to the care that's provided, which Dean mentioned when talking about the nurses. We require all of our locations to achieve Joint Commission Accreditation. So this is the same gold standards that top hospitals like Mayo Clinic, Cleveland Clinic, those types of hospitals achieve. And what it does is it just separates us. We're the only company that's achieved this Enterprise Champion for Quality Award for 13 years in a row. I don't know of any other home healthcare company that has even achieved it 2 or 3 years in a row, if they're doing it at all. So this is a big differentiator for us, and it all goes back to us wanting to provide the higher standard and separating our higher standard of care and separating ourselves from others, the other brands in the industry and the other offerings in the industry, and it separates us in ways where people that are familiar with it, like our national account partners, they understand what it takes to achieve that accreditation and that award. So it shows them that we are dedicated to that quality care in their marketplace, and every location that we have does achieve that, which just definitely continues to set us apart. That's a big thing that we have. It's really important to us, but also having the director of nursing overseeing each one of the cases that we have in the office. So that's a separation point that other franchise brands don't have. Again, more ways to provide peace of mind for the families and to have them comfortable that BrightStar Care is the right person to be taking care of their loved ones, and have the nurses and the accreditation to back that up. Really just creates trust right before you walk in the door.
Great. Dean, once a franchise is up and running, what ongoing support systems can franchisees count on to help them grow?
So our job at the Franchise Support Center is really about enabling owner success, and that's measured both helping you guys grow a business to profitability as well as helping you achieve the mission you have. And you're not alone in that journey. So it starts off when you're first becoming a franchisee with initial training. So Pete mentioned we have a 2-week new owner training program that covers kind of business operations, recruiting, sales, marketing, licensing, and other topics to help you get going. And then once you're open, you're going to have a engagement with our start team that really partners with you over the next 2 years of your journey to make sure you get the training, coaching, and support you need when you need it as you go through the different phases of growth in those first 2 years. And that helps our owners get out of the gate quickly and get on the path to success. You then transition to an ongoing relationship with a dedicated franchisee business coach, and that person's a resource to you that you can reach out to. They'll help you troubleshoot challenges. They'll give you guidance and hold you a little bit accountable to the plans you come up with to help you be successful in your business. Behind that training and that start team and the operations team are our other teams, whether that be clinical team, our marketing team, our technology team, and help desk, all of whom are supporting you, delivering tools, helping you with training and meeting your needs as you start to develop expertise in applying our model and start to grow the different opportunities in your local market.
Wonderful. Thanks, Dean. My next question is actually for the both of you, so whoever wants to take it first, but just to talk a little bit about what the growth vision looks like for the next several years. So Pete and Dean, can you share a little bit about what that looks like for BrightStar Care?
Sure. Yeah, I think we should talk a little bit about that and kind of some of the things that we're working on and have worked on in 2025 and looking into 2026 as we're already almost there, which is crazy. So the time just flies by. But yeah, I mean, we're committed to smart, scalable growth, and we're looking for the right franchisees and territories that can take that, and build that business in their specific market. We've got about 420 locations open now. commitments up to another 30 or 40 that are in the pipeline that are, committed territories. But it sounds like a lot, but we're really only about halfway there when it comes to the potential growth and the potential coverage that we can provide and services that we can provide across the country. So we have some areas that, that from an expansion standpoint that we're targeting. Every state has territories that are available, so that there are opportunities out there, and we know that there's a need. So it's a matter for us of being able to serve as many families as we possibly can. So we're pretty aggressive with our desire to continue to expand and to continue to be able to provide those services across the country.
And then that's like, I think, Pete has talked about how important, growing our network is and adding great new owners into the BrightStar family. For our existing owners, and once you're in the network, I think there's a lot of things that we're excited about in terms of growth. Our last 5 years, a lot of the growth has been driven by success in our marketing, and we continue to invest in new creative and new marketing capabilities to drive leads down into the network. So our local owners can kind of convert that into business opportunity. We've had a great national accounts program, and that's actually grown faster than the rest of our business, where we're bringing new accounts on and getting deeper with existing accounts. So there's still a lot of potential upside around that program. And then back to kind of where I started, like in the continuum of care, we continue to see a lot of opportunities on the skilled side. So once you've kind of gotten your foundation built with a strong personal care business, there's plenty of opportunity to extend that into the skilled realm with both local contracts as well as national account contracts, providing you opportunity there.
So Dean, I'll throw one at you. We just came back from our annual conference, and we've had it was great to have time with all the owners. And one big topic is AI and technology. And I know we brought in some speakers specifically for that. But from a tech perspective, I know you're pretty close to it. In the end of 2025 and into 2026, where do you see that going? Technology in the home is a big topic that candidates ask us about as well. Any insight that you can share on that?
Yeah, I'd love to. We could spend all day talking about all the opportunity we see there. AI especially is interesting because it gives us opportunities we didn't have before to make our operations run more efficiently, to do things that maybe you couldn't throw enough humans at to make it happen, but now we can use AI to do it. I think there's going to be opportunities to apply it in core office operations like scheduling, payroll, and billing, to make that work go quicker and make your team more productive, as well as to help us on kind of the customer care side and the conversion side, where we'll have ways where AI can help us review clinical charts, or ways AI can help us best handle new incoming inquiries. So there's a lot of use cases that we've been discussing with the franchisee community and our tech team, and we're starting to see some of those. I think it also will make our coaches more effective in delivering the right support, the right training, the right information to owners when they need it. And we have some initial pilots we put out around that. Other care in the home that I think will be impacted by technology is, as we get more and more into the baby boomer generation as our clients, their comfort level of technology and their use of technology has been much greater than the generation that preceded them. And so I think you're going to see more openness to things that will deploy in the home, that are going to be able to passively monitor remotely what's going on in the home. So even when your caregiver's not in the home, you can still be kind of watching out for your client's health and intervening where necessary to keep them safely at home. And so we have some pilots going on in that space, and we're excited to see kind of how that technology develops to help us in our mission to provide the best care we can.
Yeah, thanks, Dean. Yeah, it's an exciting time. I mean, there's so many things happening, and technology is changing fast. Healthcare always has changed quickly, and we've been really good about staying in front of that. And I think, hearing you talk about the pilots that we're running, I think that's key for anybody that's looking at a franchise or looking at BrightStar Care in general, is just knowing that there are a lot of things happening behind the scenes to keep us always out in front. We've always been the leader when it comes to bringing things to market, tackling new initiatives, and that just continues is continuing now, and it's ramping up with all the changes in tech. Do we have some questions that came in through the chat? We're happy to open this up now and answer any questions that we can. That we can.
Hey, Pete, we did. We actually have 4 questions in the chat, so I'm more than happy to read them off if that would be helpful.
Yeah, let's go through them.
Okay, great. So our first question is, as a franchisee, are we able to service more than one city or zone area?
Yeah, so depending on the market, you'll have a population base of between 200 to 300,000 people, and then it's all separated by zip code. So the zip codes are important because that's the way that we identify, especially on national accounts, where cases come from and where we need to send them to. And then that's how clients search in your specific market is by inputting their zip code into the information on where they need care. So sometimes that definitely does cover more than one area. So it just depends on the population base. But yes, there is some flexibility there.
Great. Our next question is, if we were to support a hospital system staffing with multiple locations across many territories, how does that work? And which location would recognize that revenue?
I can take that one, Pete.
Sure.
So, where you have customers that kind of go beyond the footprint of the protected territory and the zip codes that you are responsible for, you are encouraged to work with your neighbors. They should be the ones who are fulfilling those opportunities in their protected territories. And basically, you recognize revenue based on which agency was responsible for providing the care. With national accounts, it usually works the same way. And there are some times where we partner so that if one owner can't take the business, another owner can step in and take it. But that's always done in a way where owners are aware of kind of what's going on in their territory.
Perfect. And then our next question is, as a franchisee, can you go out and get your own contracts with local supporters and systems?
Ian, do you want to take that one too?
Absolutely, and we encourage that. We do have a model with an outside sales activity as part of it, and we really want your focus as you're growing your business to be on developing not only a set of local referral sources to refer personal care, but also local contracts with facilities for staffing, local contracts with payer organizations. And so that is very much part of the model and encouraged. And then with those that you're basically just signing a contract for services and you have an agreement with them directly.
Perfect. And then our last question here, and maybe this can be taken offline a little bit too, but what has been typically a return on investment, like over how many years?
Great question. One we get asked all the time, and one that we have a hard time answering because it really depends. So, what I would say on that question is I would direct you to item 19 in our FDD. And so, item 19 is the financial performance representation of the brand. And what you'll see in there are revenue numbers from the past year, and it's very detailed. So, I would say I've been involved in franchising a long time. And I would say our item 19 is the most detailed one that I have ever seen, but it actually breaks down in various parts the revenue split, the overall system-wide revenue by quartile. We get into the number of caregivers needed to reach a certain threshold, the number of revenue, number of clients needed to reach a certain threshold of revenue. So all of that information is in item 19. And that would be your best resource. And from there, with all of the data that's in that would be a good way for you to build that model to get your answer. Also, during the process of due diligence, you're going to have phone calls and validation calls with existing owners. And that's really a great spot. One of the things that you'll find about BrightStar Care owners, they have a very tight bond, and and it's a very strong network of franchisee to franchisee conversations and support. They've all been in your shoes, and at this stage where you're looking at and considering the business, they are super helpful when it comes to getting down into more of the line item details of how their business works and how that might translate into the market that you're looking at. So you'll have lots of opportunities along the way to get that answer and feel really comfortable with it.
Awesome. Thanks, Pete. And I do just have one more question that just came through, and I think this is a good one. It is, what is a typical size of a BrightStar Care franchise business? Number of contracts, clients, revenues, etc.
Dean, do you have stats on that? It varies depending on the age of the location and their product mix.
Yeah, it is like one of those it depends questions. I think, we tend to say like what's the average unit volume of a BrightStar territory and revenue, and I think that's something you can get from the FDD if you do the math. And so I'll direct you to the FDD for that. But typically we're trying to have in your first couple of years building a bench of caregivers and building a bench of clients, and you're talking like 20, 30, 40, 50 of each in those first couple of years, and that's kind of what you should be shooting for as you get out of the gate. The local clients you develop are bolstered by your national account business, and those national account clients tend to be shorter hours than the clients you go and get locally yourself. I remember like when I was running my agencies, like one of my first clients we got stayed with us for multiple years and turned out to be like one of our biggest clients. So it really is hard to boil it down to just averages. There's such a variation, but you can get some of that by looking at the math that's in the FDD.
Yeah, and I think from the variety of clients that an agency could have, they could have a 24/7 case, like you said, that's with them for years and years. And I know we have other franchisees that are getting into pediatrics, so that's a different, kind of a different part of our model. So it depends on the type of cases that you have. But the foundation that Dean talked about, getting that foundation of the core business set up in that first couple of years, that really is the key, because that tends to open the doors for other opportunities along the way.
Wonderful. Thanks, Pete and Dean. Pete, we do have just one more question. Maybe we'll cap it here at this last one since we do have a couple more minutes. Is that okay with you both?
Yep, that sounds good.
Okay, cool. So our question here is there any possibility of buying a franchise business on sale that will enable to jumpstart the business rather than do everything from scratch that will involve time?
That's a great question. And with where our brand is in the maturity level, there are definitely resale opportunities out there. We've been franchising for 22 years, and we have many franchisees who are coming up on their franchise agreement renewal or coming up on their second franchise agreement renewal. And there's opportunities where people are retiring. So that is a possibility. So I'd work with your franchise developer. Um, the I would say that it does provide you with a little bit of a jump start, but you also pay for that. So if it's a high performing agency, they do operate off of a sale price based on a multiple of EBITDA or on owner discretionary income. So your investment may be higher for something like that, but they are out there. We do a lot of franchisee to franchisee resales where the neighbors all know each other and they have developed a relationship, and when one is ready to retire, the other one's ready to take over that operation. And I think that speaks volumes for the brand, and the satisfaction that the franchisees have where they're looking at those opportunities to scale by working with their neighbor. But yes, there are a handful of resale opportunities out there, and if they're available in your market, we will definitely get you in touch with them. So I'd work with either Chris or Amy, whoever you're working with on development, and they will let you know if those exist.
Perfect.
Awesome.
Pete, there is a follow-up question to that, if maybe I want to pose that super quick too.
Okay.
Before
Sure.
Follow-up here is how complicated is it to transfer the licenses from one owner to another owner?
Ooh. I don't know if it's my end or are we back? I froze.
Yeah,
You
big
did.
row.
Oh, you're back,
No,
Pete.
I'm back. Just that was just a glitch in the system. So can you repeat the question, Claire?
Yeah, of course. How complicated is it to transfer the licenses from one owner to another owner?
Okay, so it really depends on the state. So that's the answer for that one. And during that process, if you're looking at an existing and the coaches will help you with that. You'll also need to transfer over the credentialing for the national accounts, and so the national accounts team helps you with that as well. So we have a two-step process to an existing sale where we have the soft close, and then during that period of time before you take over an existing location, all of that licensing takes place, and then you can do the actual hard closing. So just depends on the state.
Yeah, every state has a process, and it's a quite common occurrence. It's happening all the time in those states that people are transferring licenses.
Yeah, it's great. Good questions. That's awesome. Well, these have been great questions, and if any questions come up after the fact, you can still put them into the chat, or you have contact information that we can get the questions answered for you. We're excited to have you be able to join us today, and you'll get another follow-up email with a copy of the latest white paper. For those who may have an older version, we'll get you the new one along with some other resources. And reach back out or continue to work with your franchise development person, whether that's Chris or Amy. We'd love to continue the discussion and continue this on and make sure that BrightStar is the right opportunity for you and how we can make that happen. So, Dean, thank you so much for joining us, and thanks everyone for attending.
Thanks, everyone.
Thank you.